Okay.
Okay. My name is Jonathan, and I'll be refuting Ms. Bartolone's claim that testing cosmetics on animals is unnecessary. This is absolutely not true. The FDA defines cosmetics by their intended use as articles intended to be rubbed, poured, sprinkled, and sprayed on, introduced into, or otherwise applied to the human body for cleansing, beautifying, promoting attractiveness, or altering the appearance. Among the products included in the definition are skin moisturizers, perfumes, lipsticks, fingernail polishes, eye and facial makeup preparation, shampoos, permanent waves, hair colors, toothpaste, and deodorants. As you'll see later, the definition is very important. Ms. Bartolone's first claim is that new methods have been discovered that can replace the use of animals. Relying on her source, I called on MB Research Laboratories and interviewed the Director of Research and Development, Stephen Dancer. He disagreed with Ms. Bartolone's physician. Mr. Dancer stated that while limited alternatives testing is available, testing on tissue constructs are nowhere near testing on the real-life animals or humans. Mr. Dancer said that most of the ingredients have all been tested, but when it comes to new chemistry and products, it's a different story. He said that some of his clients want animals to be tested, while some do not. It's a simple matter of how sure the client wants to be that the product is safe. If the idea is that using inanimate objects are going to replace testing of cosmetics on animals, then why is animal testing still being done? And it's as simple as if it harms animals, it could harm people as well. These alternative test methods for skin irritation, toxicity, and other negative effects. But is that all we look for in cosmetics? When we grab a bottle of lotion, are we thinking, is it going to kill me? As I remind you, the FDA defines cosmetic article as cleansing, beautifying, promoting attractiveness, and altering appearance. How can the smoothness of a hand lotion or long-lasting of a lipstick be tested on a sliver of time-sensitive synthetic skin? To this day, real skin cannot be duplicated, so testing how anything would feel or how it reacts over time must come from a live specimen. Results you can't get by looking in a petri dish. Ms. Bartolone's second claim is that testing cosmetics on animals is expensive. Ms. Bartolone cites that animal testing costs the public over $136 billion a year, or $300 a family. Ms. Bartolone never stated that this data came from cosmetic testing as opposed to other animal research. Without knowing whether this was only limited to cosmetics, the data is irrelevant. From a practical standpoint, her data is clearly flawed. Taxpayers do not pay for cosmetic research for private companies. Families do not pay for research. The money for research and development is part of the cost of doing business and selling a product. She confused the data with the medical research grants. Mr. Dancer advised that it is actually more expensive to conduct in vitro tests than it is to test on animals. To put cost into perspective, Mr. Dancer stated that it costs about $1,300 to conduct tests on a rabbit, and about $3,000 to $4,000 to do in vitro tests, such as the methods that the advocate mentioned in her speech. On top of everything, the whole system is based on economics. If something is too expensive, then demand will go down and people will not want to buy it. The market dictates. If products that use animals for testing cosmetics were more expensive than non-animal tested products, sales would plummet for these companies. That isn't happening. Mr. Product's third and final claim is that the animals used in testing are built differently than we are, and thus react differently when humans from these products. Many medical treatments have been made possible by animal testing, including cancer, HIV drugs, insulin, antibiotics, vaccines, and many more. It is for this reason that animal testing is considered vital for improving human health, and also why the scientific community and many members of the public support its use. New drugs, in particular, can carry significant dangers with their use, but animal testing allows researchers to initially gauge the safety of drugs prior to commencing trials on humans. And this same would apply for cosmetics that haven't been tested yet. This means that human harm is reduced and human lives are saved, all the sake for improving the quality of human life. Researchers do recognize limitations and differences, but testing is done on animals because they are thought to be the closest match and the best one with regards to applying data to humans. It will be great when we no longer need to use animals for testing, but the reality is that our technology just isn't there yet. Thank you. Thank you, you too.
How was that? 4:45.
Let's get it over with.
Yeah, you don't want it hanging over your head over the weekend.
Nah.
We have other things to do next week also.
Nice impression in my head after all that research. I really called that guy.
Yeah, hang on a second. I got a couple comments for you.
Okay.
All right, I thought you did a really nice job on the argument, especially in the last part when you're summarizing the issue. You put everything in context. You gave us an explanation. I thought on the middle part where you're talking about the cost, the explanation about how they might have, how she might have mixed the cost of doing all animal research with the issue of doing cosmetic animal research. I think that's a good point. And there's a pretty straightforward way of doing this. She mentions $136 billion. I got a question for you. How much cosmetic sales are there in the United States every year? If there's $136 billion in cosmetic sales in the United States each year, I would be amazed. You know, so it seems pretty clear that it's probably she's conflated the two and assumed that they are connected to each other when they're not. And I think that that's a reasonable challenge to make, and that would have strengthened a little bit more. Calling the guy, for instance, I'm glad that you went ahead and called him. You found some way to get a hold of him?
Pennsylvania, yeah.
Well, that was okay. And he answered some questions for you?
Yeah, it was.
That was nice. So did you contact him through a website? Or
yeah, Google MD, actually one of her sources, like MD Laboratories, and just contact us. And so I called him, Metro PCS, and so I asked who can I talk to. I'm doing an essay, I need some questions answered. Who can I talk to? And then we transfer you. I'm like, okay. There
you go. Isn't that nice? Like, you can go out and dig up some research. Now, normally we'd, of course, want you to have a source that you could quote that the other person could be able to find, but in this context, I think the way we talked about it, it's a little understandable about why you had to go through that process. And I thought that it was a good idea that you did because it helped you come up with some good answers there. Okay, thank you.